You've done it again, another sprained ankle. But what you do next can either hurt or heal and prevent future ankle sprains. Hey, welcome to Uplift PT. I'm Dr. Luo, physical therapist, and today I'm going to show you 4 exercises that are going to help you to recover faster and prevent future ankle sprains. Now, these exercises are designed for an inversion sprain. That's when the ankle rolls inward and you get a sprain of the lateral ligaments. Before we start, make sure to speak to your local doctor or physical therapist to make sure that these exercises are safe for you. Seriously, you could do more harm than good if you have more than just a minor ankle sprain. With that said, let's get into it.
Pointy ballerina.
First, we're going to restart the muscles at the lateral ankle. Anytime you have trauma, like an ankle sprain, the whole area goes into shock and things forget how to function normally. So let's re-educate these muscles with the pointy ballerina. Now, this is called plantar flexion, this motion from here down to here. And if you've had a recent ankle sprain, this might be a painful motion for you. So just go to wherever you're comfortable. If you can only go to here without pain, that's fine. Do the exercise there. But once you're there in your plantar flexion, however far you can go, you're going to slowly evert the ankle like that. Go ahead, Sharon. Eversion is when your ankle goes out like this. The ankle goes from neutral here out. You can also evert in plantar flexion, which is what we're doing, and that looks like this. The opposite is inversion. This is inversion. And this is actually the mechanism of motion where most people sprain their ankles. Plantar flexed and inverted. That's why this motion will likely be painful for you. Make sure you go slowly. This is a neuromuscular exercise. That means we're strengthening the brain to muscle connection because any little movements can either cause you pain or delay healing. That's why it's important to use the muscles to bolster the ankle. If the muscles are working to hold your ankle together, the ligaments don't have to be tugged as much and they have a chance to heal. Finally, if it's been a while since you've been injured and you want to progress this exercise, you can take a band, a TheraBand, or any kind of resistance band, put it on the outside of your ankle, and then go ahead and do the motion. Make sure you secure the other end to a table leg or a door hinge. On to the next one.
Roof raisers.
Next, we're going to stabilize the foot. Most of the people I treat who have ankle sprains also have some foot instability as well. If you're standing on something stable, you're less likely to sprain your ankle. Simple as that. So we're going to strengthen the arch. For this one, you need to be standing. Place a coin or a pen underneath the arch of your foot. Slowly raise your arch away from the object, but don't lift the ball of your foot or curl your toes. We want to work the arch muscles. It may feel impossible at first, but as you become more aware of the muscles in this area, you will learn to control them as well. Slowly raise your arch and then come back down. Raise it up and then come back down. You should feel the ball of your foot going closer and closer to your heel as your arch goes up, and don't let it leave the ground. Ankle alphabets with a twist. Next, we're going to put these 2 exercises together into one called ankle alphabets. This is a very popular exercise, especially for those familiar with ankle sprains, but I'm going to add a little twist. Start by positioning yourself in sitting or lying down with your foot elevated. Then proceed to draw each letter of the alphabet with your toes, all capital letters, very slowly, as big as you can. Now here's the twist. Keep your toes curled throughout the entire exercise. This adds a foot component to this exercise. We can't ignore the foot when we treat the ankle. Alright, so expect a bit of a foot cramp. If you do cramp, you can either push through it, continue the exercise, it won't do you any harm, or if it's too much to bear, you can stop, stretch your toes back, allow the cramp to subside, and then resume your exercise. Cramping is good. It means we're waking up muscles that haven't been used in a long time. So push through that cramp. get those foot intrinsic muscles to activate.
Single leg stance.
Single leg stance is working on something called functional proprioception. Functional as in you're using your ankle as you would in your daily life. Proprioception is your brain's ability to tell where your body is in space. And for those who roll their ankle over and over again, they lack proprioception because they're not aware of what their ankle is doing at any given moment. So, you're gonna roll your ankle again if you don't work on your proprioception. So let's work on it. This exercise is very simple. Stand on the ankle you want to rehab. Doesn't matter what the other leg is doing. Try to work your way up to a minute. If that's too easy, try doing it with your eyes closed. After you've reached a minute, you can start multitasking. Stand on one leg while you're on your phone. Practice juggling. Play catch with someone. When you roll your ankle, you aren't thinking about your ankle in the moment, so you want to train your ankle to be stable while not thinking about it. That's what proprioception is. Those are the 4 exercises. They may seem easy, but remember, we're not trying to sweat or get bulky ankles. We're working on neuromuscular connection. That's brain to muscle, which may be the most important of all. We want to teach your ankle how to move properly and prevent injury. If you found even one of these exercises helpful, hit that like button. Subscribe and hit that bell to learn more about preventing injury and mastering your body to work for you. I'm Dr. Joey Luo, physical therapist at Uplift PT. Now stop watching the video and get moving.